joined by Dr. Ben Emery from Aspen Ridge Dental. Thanks so much for joining us this morning.
Good morning. Thanks for having me.
Absolutely. So we are here to talk about stubborn preteens and teens. Now, you see them all the time, but what are they most at risk for?
Cavities. You know, it's the back teeth, the chewing surface of cavity or of molars and premolars, or the back teeth are the most susceptible areas to get cavities. And oftentimes teens, you know, one, they don't have the manual dexterity to really clean back there with a toothbrush, or they don't really have the patience and they don't really care to do that. And so those are the surfaces that are mostly affected by cavities. Some advice for kids and preteens and teens: brush at least twice a day, floss once a day, avoid sugary substances, starchy foods, things like that get stuck in between teeth and on the chewing surfaces.
Okay, so are they just not brushing long enough, or they're not using the right technique, or is it a combination?
It's probably a combination of all those. So the chewing surfaces are the most susceptible to cavities, and that's why your dentist may, recommend that you place sealants on those back teeth, the molars and the premolars. And a sealant is a plastic coating that goes over the deep depressions and the grooves in the back teeth that are hard to get, or hard for the bristles on a toothbrush to reach. And so the sealant actually blocks out any sort of food debris or plaque that can accumulate on those surfaces, so that the plaque and the food doesn't sit there, which creates cavities.
Okay, and I think we actually have a picture of a sealant, if we can pull it up. But now sealants, they fade away over time, correct?
Yeah, oftentimes they do. They hold up really well to natural chewing forces and everything, but they may need to be reapplied in several years, but usually they hold up really, really well under all those forces of function and chewing. Okay,
and the nice thing is that, as you can see, I mean, they're the same color as the tooth. And so is that a tooth without a sealant?
Correct.
Okay.
So a tooth without a sealant, and you can see the grooves and everything. If you leave it uncovered with sealant, they become stained and everything. That's accumulation of bacteria, which can lead to cavities.
Okay.
And so if you block that out with the sealant, then bacteria and plaque can't sit in there to create the cavities that oftentimes affect preteens and teens.
Okay, so this is more of a preventative measure from getting cavities. How long does getting a sealant take, and is it invasive?
It's not invasive, and it only takes a couple minutes to do that. We have to use really good isolation techniques, meaning make sure the field is really dry, and just clean the tooth really well, and then apply the sealant that bonds to the tooth, and that's basically it.
All right, excellent. Well, if you have more questions, you can head on over to Aspen Ridge Dental. You can give them a call and ask Ben yourself. Thanks so much for joining us.
Thank you.
All right.